2 minutes to make one?
Yeah.
Okay.
You have 2.5, actually.
I was trying to be quick.
No, you're fine.
How are you?
Good. How are you?
Good. You can come see me again soon?
I can see
I just want you see me.
Did you get anything new?
It arrives tomorrow. Yeah. So come.
Test 1 2 3. Test 1 2 3. Test 1 2 3 4 5. 1 2 3 4 5. Testing 1 2 3 4 5.
Coffee. Didn't we say we were going to do coffee
Oh,
next
yeah.
time? I was clearing out 9,800 photos on my phone. And so Jasper,
Is somebody
Heather, this is just a media briefing. They've been getting so many questions here to the health department that they've decided to start instituting twice a week media briefings to answer some of those questions. Dr. Martha Buchanan with the health department will be here shortly to begin answering those questions. They've just had such a high interest, as you might imagine, from so many people and different media outlets asking about coronavirus, COVID-19, especially now with the first confirmed case here in Tennessee. There are no confirmed cases in East Tennessee as of right now, and we're told that we shouldn't expect any announcements from Dr. Buchanan changing that today at least. They're continuing to monitor the hospitals throughout the area as they do testing on those cases. We've heard from Governor Lee this morning, as you said. He said he started the coronavirus task force in the last 48 hours or so, announcing the first case today. In that announcement, he said there is a low risk to the public and that Tennessee is one of the first 5 states in the nation to begin testing for coronavirus, a hallmark that he's definitely going to be touting as more and more cases we expect to pop up. Just this morning, Dr. Buchanan on 10 News Today saying that it was basically inevitable that we would eventually have a case here in Tennessee. Now we're answering more questions from her as she answers those questions about what the preparedness level here in Knox County is and how that testing works. Heather? Thank you. Thank you.
You're welcome. I'm gonna go through, yeah. Buchanan, I was thinking you guys could just do live mics, and we'll set her up over here. So, and let me know if any chairs, once you get your shot frame, if any chairs need to be moved.
Okay.
I'm gonna hold this
cover
for
her?
you.
Oh, okay.
Anybody
It's like,
else wanna
it's like Pink
have a seat
Mafia.
while we're moving?
No, it's funny. It's like a skill to learn how to put it on and not look like a ding dong.
Well, not looking
And
at
just tell me,
wires hanging out of
and
you,
go
too.
ahead and tell me, don't tell me I look like a ding dong. Just be
Never,
quiet about it.
Never, Dr. Booth.
Need some, you need a tool, Bill.
Yeah, exactly.
Just wanted
Like
to
a
get
strap
on.
across. Long ears.
Who's next? All right, we'll go to the other side. Going to the other side.
Oh.
Yeah, I'll pick it up in a second. Let me. Okay, this one I can never figure out how to do it the other way.
I
There's
think I've got this one set
Yeah,
for that,
thank you.
so
it's always.
to twist them around.
Yeah.
I feel like that's always when I break them. I can do that
You're
one,
on.
that
Are you
one
on?
clip.
Are you live? You're not live.
We're streaming live.
We're streaming. Oh, we're streaming. Okay, cool.
And Doctor, if you don't mind, I think there's a switch on top
Yeah,
of our
there,
pack.
that's what I was asking.
Oh, okay.
This one.
No,
No,
we're
the other one.
already on you.
You're already on me.
Yeah.
Okay, here we go. Have that one.
All right.
Did you get it? Thank you so much.
On white balance, or are you good at this point?
Yeah, needs to go that way.
She'll probably be, yeah,
And
probably right about there.
Kelsey. Oh, I see. How you-
Do you want me to?
I'm sorry.
No, it's okay. It's
Oh, the
just-
clip is off.
Well, see, to do it that way, it's going to be on the inside, and that way, I'll just put it over here. I'll sit sideways.
Sorry.
I might be able to switch it around.
I couldn't figure out how to switch it.
Oh, this one's a
It didn't
different
want to
one.
switch.
I think you just have to
you
pull
get
it
turned
out
on?
of the,
I did. We just gotta reattach it.
more work than
Okay.
trouble than it's worth.
Yeah.
Don't shoot my hips, okay?
Or you
No,
do
this
it.
thing's-
Would it be all right to just put it on?
Yeah, I'm fine. I'm fine.
Sorry.
Okay.
Even though.
Let's see. Hold that for me.
Yes.
So we'll be all-
Maybe I'm laying sideways anyway, but
Thank you. I appreciate
you just did all that so you could be at the top, didn't you?
I did.
Yeah.
Strategy.
You get that sound, just that millisecond faster.
Yeah.
That's the scoop.
Hold on. I'm sorry, guys. You know, I've done this enough. I should know how to do this, but I don't normally have to wear this many things.
Inspector Gadget.
Yeah. All right.
Yeah, that looks
What
good.
were we talking about?
Is that where you guys want her, right there?
Because I'm assuming you guys want me to just look straight ahead, right? Or something like that. Somebody's gonna have to stand for look at.
Yeah, I can stand right here if you want to look at me.
Yeah, that's what
Does that work for everybody else?
your predecessor did before.
Very nice.
Sorry, I don't want to look like a government employee.
Right?
Okay, you guys, are we ready?
I told you guys pretty much the format earlier, but this is a media availability, so questions that you have, you can kind of circulate around the room and ask Dr. Buchanan some questions, but I'm assuming you'd like her to say and spell her name first. So if you want to go ahead and do that.
Go for it.
Martha Buchanan, Martha Buchanan, MD. I'm the director of the Knox County Health Department.
Dr. Buchanan, what's your reaction to the news this morning that there's a first case in Tennessee?
Well, you know, with as much as we travel and as international as we are, it's not surprising that we have a case in Tennessee. It wouldn't surprise me if cases in every state in the nation eventually. And you know, public health was expecting this. We're prepared for this, and I understand that the folks over there in west of the state.
Dr. Could you speak to how many tests have been administered in Knox County at this point, and could you speak to the availability of tests in our area?
I cannot speak to the number of tests that have been done, and the availability of tests is a Tennessee Department of Health question. They're the ones who are running the tests.
Do you know where they're stored and how they're administered between different medical facilities?
No, that was a great question for the Tennessee Department of Health lab.
And the process, if you don't mind, would you, while a lot of that is at the state level, as you mentioned, could you talk to us about the testing process and how long it takes to get a positive or negative?
Sure. So what happens if somebody qualifies for testing? So in the state of Tennessee, people still have to qualify. So they have to have a risk factor and symptoms. And so if they meet those two qualifications, if they've been exposed and they have symptoms, then the Tennessee Department of Health would okay them to be tested. So then collects the specimen, We actually collect 2 specimens, one from the nose and one from the mouth. Those are put into containers that are appropriate for shipping, shipped to the Tennessee Department of State lab, where they are tested presumptive, positive, or negative. So if they're negative, we're done. If they're presumptively positive, those specimens are then sent to the CDC for further testing and confirmation. The results you're hearing from most places across the country, including the one from Tennessee this morning, those are all presumptive positives. The test that they're using to get the presumptive positives is a pretty accurate test. And from what I understand, most of the folks who have been presumptively positive have ended up being positive at the CDC level as well. I don't know how long it's taking from presumptive positive to the CDC results. That can take a while. As you can imagine, it's a bit of a backlog. Right now, my understanding from the State Department of Health is that we are able to get test results within about 24 to 48 hours of submission. It kind of depends on what time they arrive in Nashville and when they can get to them. I mean, they're prioritizing those, but timing is important. Takes time to run the test, and they have to have enough time to finish it. It's not something they can leave.
Hearing possibility of persons being tested at UT Medical Center, at least 2, and 1 child potentially being tested from a Knoxville Autism Center. Any truth to that? Can you dispel any myths?
Wow, I cannot comment on anything being done in Blount County. That's specific to Blount County, and that's a different jurisdiction in public health. We have tested some folks in Knoxville. I don't remember what the facilities were and where they where they came from, to be honest with you at this point. I'm unaware of any child being tested, but certainly doctors' offices can go straight to the State Department of Health to request testing, and that might be approved, and they would notify us later.
Presumptive positive cases in Knox County.
There are no presumptive positive cases in Knox County. That is correct.
Can you talk a little bit about some of the preparation? How do you interact with other agencies like the schools?
Sure, that's a great question. I think it's important for our community to understand that we are prepared. We're planning. All planning is great, but obviously things happen that you don't anticipate. So we have plans for lots of different things. So we have always had a novel virus plan at the health department. It has to do with what we do with the community. It has to do with what we do internally. It has to do with how we work with other partners. Other different government divisions support that if we were to have to do certain things. So that's all written out. We've pulled it out. We're reviewing it. I meet this afternoon with the mayor, the county mayor, to discuss that and discuss what his plans are. The county has what's called a continuity of operations plan. Most continuity of operations plan plan for about 3 different things. One, maybe the building's gone, something happened, natural disaster, and people have to work somewhere else. They can't work at the city county building, or maybe they couldn't work here. 2, not enough people to do the job. They're either sick at home with their kids or whatever, they're scared to come to work, but not enough people there to work. Or maybe we have an IT problem and we can't, we're so dependent on IT that we can't do our jobs because we don't have IT. So everybody has those, or most governments have those plans, and I know the county has one. It's not been looked at in a little while. In addition to that, my staff is meeting with our other partners like long-term care facilities, emergency responders, the Red Cross. There's a big long list of folks who have a role to play, and asking them to pull out their plans and look at them, update them, make sure they're accurate, make sure all contact information is accurate. Is this still how we want to operate? So we're looking at all of those things. So those plans are there. When we think about the schools, the University of Tennessee has a very extensive continuity of operation plans for all kinds of contingencies, and we are in contact with them and in regular communication with them, as well as Knox County schools. They're looking at their plans and considering what need. We'll be meeting with them soon to help identify any gaps and help address any concerns that they might have.
And Dr. Buchanan, schools in Williamson County are going to close for a deep cleaning after that confirmed case. In terms of y'all's plan and in coordination with KCS, or KSC rather, no, KCS was right. Is that an automatic trigger if there is a presumptive positive that the schools will close for a deep cleaning?
We would make that decision in concert with Knox County schools and with guidance from the Tennessee Department of Health and the Centers for Disease Control. So I don't think it's an automatic. I think it's a conversation to have with the schools based on the situation, based on what we know at the time. As we know, the situation's changing every day, almost by the minute, it seems to me. And so the guidance may change by that time. If those of you who were here, if you recall during H1N1, guidance changed from the morning to the afternoon, and we had to talk about how we were going to handle that. So that's a decision made between us and the schools with guidance from TDH and CDC.
At this time, what is your advice for local hospitals and local long-term care facilities in dealing with potential cases?
So in dealing with potential cases, we want them to contact us so that we can walk them through whether that person really is a potential case and whether that person qualifies for testing and get them tested and guide them on what the person needs to do. Someone who's truly a suspect case, we're asking them, if they don't require hospitalization, we're asking them to self-isolate with even the people in their house so those people aren't as much at risk, and watch their symptoms, and we'll get the testing done and inform them of those results afterwards. And based on those results, we'll provide them guidance for what they need to do next. As far as long-term care facilities, all of our long-term care facilities have infection control plans that they activate on a regular basis, actually. They might have a flu outbreak, they might have a GI illness outbreak, and they activate those infection control plans, which means they don't bring everybody together to the dining room to eat. They stop social activities. People have to stay in their rooms. It's really challenging for folks because their socialization is coming out and working puzzles or playing cards or whatever, and having meals together. So it's very isolating for those folks. But they have those plans and can activate them really quickly. They consult with us regularly, and we are actually meeting with the long-term care administrators soon, maybe next week, I think, to just kind of touch base with everybody, answer their questions, and see what they might need.
Have you met with the Department of Corrections or like jails?
We have not met with the Department of Corrections, but they are part of, the Knox County Sheriff's Office is part of one of the groups that we'll be meeting with. I think that's also next week.
People are receiving notes that people at different workplaces and schools are being tested. Is this something people should worry about? Is the health department being made aware of such notes that people are seeing?
I haven't seen any notes, but what right now in the state of Tennessee, the only lab that can test for coronavirus is the Tennessee Department of Health lab. And they have to approve that. So that has to go through either the Tennessee Department of Health or the local health department, or well, it has to go through both if it's the local health department. But there are no commercial labs that are testing. Doctors have to go to the health department to request testing. People have to meet certain criteria. They have to have traveled to certain places, need those level 3 places, and have symptoms or have been exposed to a confirmed case of coronavirus and have symptoms. So it's pretty tight. So the testing is going through public health, and we hope we're aware of most of it. Obviously things happen, but there are no commercial labs doing testing at this time. That hopefully is going to come online, and then folks will be able to be tested more freely.
How should people talk to their kids about coronavirus? And what about hand washing? Does cold water help at all? Does it have to be hot soapy water?
So people should talk to their kids about the coronavirus just like they talk to their kids about any other infection. The flu, GI bug, coronavirus, hand washing, staying home if you're sick, covering your cough, using a tissue and throwing that away and then washing your hands. Doesn't matter what temperature the water is. The important thing is soap and rubbing your hands together long enough that that soap gets nice and sudsy, and then that captures the dirt and germs and washes them away down the sink. So water temperature doesn't really matter, except most of us don't want to keep our hands under cold water very long. Alcohol-based hand sanitizers work as well. 60 to 95% alcohol. It has to be alcohol-based. The other bases don't work. They've actually been shown to increase germs on your hands. But I also want to remind folks that for the general population, even though we have a case of coronavirus in Tennessee, for most of the state of Tennessee, you are more at risk for getting the flu right now than you are for getting the coronavirus. You have to get exposed to the guy who's sick. And so unless that's happened, your risk is really low.
I have 2 viewer questions, Dr. Buchanan. The first you've already touched on a bit. If I have a fever, what do I do? Do I go to the ER? Do I pull as this virus is sort of, I guess, making its rounds? Should people be leery of touching money?
So I'll take your first question first. I think you need to use your judgment on whether you seek care. If you have just a fever and no cough, It's unlikely to be coronavirus. If you haven't traveled somewhere where coronavirus is being actively transmitted, it's unlikely to be a coronavirus. My advice to somebody who has a fever is if they feel sick enough, pick up the phone and call their doctor and get some advice from their doctor, or take something over the counter to reduce that fever and see if it helps. As far as your second question, money certainly can transmit. I mean, it has stuff on it. It's not a bad way for things to get passed around. However, what they find with the coronavirus is it really is more of that human-to-human touching. It's not really solid surface. Money's not really solid, but it's more like a solid surface. So, obviously the person would have to sneeze in their hand and hand you the money or something like that for that to be the vector, as we would call it, that transmit the viruses to you. So you'd have to touch that money and then touch your eyes or nose to get that. So that's kind of not very likely.
Why are the testing procedures so stringent? Is it because of limited availability of testing kits?
It is because of limited availability of testing kits at this time. I know we've heard from the federal government and others that they're going to be making more test kits available. But right now we do have a limited supply, and we have to use those wisely only on the most at-risk folks so that we can get a picture of what the illness really is. If we use them up on people who really aren't at risk and we get a bunch of negatives, that doesn't help us have a better picture of who needs to be in isolation and who doesn't.
If there are cases that require hospitalization, is there one specific hospital in our area that people would likely go to? Is it UT?
Which hospital they go to is personal preference. All of our hospitals are prepared to handle infectious diseases. They handle the flu every year. They handle other infectious diseases. They all have negative pressure rooms. They all have the equipment to manage that and are prepared to manage any person who might come into their facility.
Are you in constant contact with the CDC?
We are not. The State Department of Health is not in constant contact. I think they're in daily contact with the CDC. We have phone calls with the Department of Health twice a week, but can also pick up the phone and call them at any time when we need to consult with them.
Dr. Buchanan, you gave us some perspective in terms of more fearful than or someone who says, I'm scared.
Mm-hmm.
What would your message be to them today?
I think people need to step back and think about what the true risk of getting coronavirus is. So right now, the true risk for anybody in the state of Tennessee is either having had direct exposure for more than 6 hours, less than 6 feet with the person who was diagnosed in Middle Tennessee. And those people have been contacted by the people at the health department in Middle Tennessee and are being evaluated and monitored and advised. The other risk is to have traveled to a place where there's ongoing community transmission. We're not there yet. We are not to the point where we're having community transmission. That means that you can get it just in regular everyday activities. You don't have to be in that close contact. It doesn't have to be a household contact. People are passing it. It's what we do with the flu. Eventually, every year, we eventually have widespread community passing of the flu. So we don't have that in Tennessee. So regular everyday activities do not put you at risk. If you're caring for someone who has been confirmed to have COVID-19, or if you've traveled to one of those places where they have ongoing community transmission, you are at risk, but otherwise you're not.
And those places are like Italy, China, countries outside of the United States?
Yes, Italy. Right now the list is China, Italy, South Korea, and Iran. And it's changed. The reason I'm looking at them is because it changes based on number of cases, and that's getting updated regularly.
Can you speak a little bit to employers, because you're asking people to take time off when they feel sick, right? But a lot of hourly workers do not have time off to take for sickness, and they risk getting fired for taking time off.
Right. It's a real challenge. It's one of the challenges for, obviously it doesn't matter what illness we're talking about. If you're sick, we really want you to stay home so you don't make your coworkers sick, so you don't make your customers sick. Nobody wants to do that. But we also understand that it's a real challenge in some industries where they don't have adequate leave policies that allow people to take time off and still get paid and be able to take care of themselves or their family. So it's one of the things we run into that regularly when we have a restaurant worker and we ask them to stay out of work because they have an illness and they shouldn't go to work. It's a real balancing act. So what I would say to employers is it's time to review your leave policies and make some, either make some exceptions or make some new leave policies that allow people to be able to stay home and take care of themselves and not make other people sick, or take care of their children and not have to send their children to school and make other people sick as well.
Dr. B, are there cases here in Knox County where people are self-isolating as they wait test results?
We do have people self-isolating because they've traveled. So we're asking anybody, right now, if you come back from Italy, North Korea, Iran, South Korea, not North Korea, South Korea, Iran, or
China?
Italy.
China, no, China, okay, sorry, I thought there was another one. I apologize. So we're asking people to self-isolate. If they have symptoms, we're talking to them and getting them tested if it's appropriate. So we do have people self-isolating, not necessarily even waiting on tests. They're self-quarantining, really is what that would be called, waiting to see if they get sick, and to call us if they get sick. So we're in contact with folks who are traveling. Somebody coming back from China, the CDC's getting those manifests, and then the Tennessee Department of Health gets those manifests, and then they pass them down to us and we reach out. So folks who are coming back from China, from the Hubei province, they actually are having to talk to us regularly and take their temperature a couple of times a day. The other folks don't necessarily have to do that as tightly.
If we had a test come back, oh, I'm sorry.
I was just going to ask, are there tests that you're waiting to have come back now from the lab?
We have tested people in Knox County, and we are awaiting some results.
How many are self-isolating and how many tests?
I can't answer that question because that's in my head. I'm sorry.
I'm going to follow these guys in the same line of thinking is, so you have these test results coming back. Will we hear these test results if there is a positive from you, or will we hear it from Nashville, from the governor?
So that's a conversation we have to have with the Tennessee Department of Health, to be honest with you. Our intention is to inform our community when we have our first positive. After that, it'll just be an update on the number of people who are ill, because that number may grow, but that's our intention when we do have a first positive, to inform our community. We'll try to do that. We will do that in concert with the Tennessee Department of Health. I believe their desire was to be out in front of the first case. So I think if we have a case, I think that they'll be fine with us making that announcement. But that's a conversation with the Tennessee Department of Health.
Do you know if the University of Tennessee or other employers who have workers who travel to a lot of these countries, are they taking any measures that you're aware of?
We are in daily conversation with the University of Tennessee, because they don't just have employees, they have students that they're calling back from all of these countries, and we're providing them guidance. And they're working really closely with us and doing a really great job of managing those folks who are coming back to them and keeping us informed. So they're following the guidance from the CDC, just as we advise every other employer to do. That guidance is changing almost every day, so you have to look at it regularly. It's updated at noon, and then again the next day at noon, so it changes regularly. And so we encourage employers to go to that website. They have specific guidance for employers on what to do. It's based on the country they traveled to, and again, that country list changes. We anticipate that to change. Actually, I think it's changed since this morning. It's continuing changing, but UT is doing a really great job of managing that and providing guidance for the folks that are either students or staff for them.
Have you been talking to churches at all who are planning missions abroad?
We haven't. Actually, we did during Zika talk to churches a lot. We haven't had any churches reach out to us yet. It's a challenge. Churches don't have any one central way to talk to them because they're kind of divided a little bit. So it's something on our mind. How do we reach out to churches and get them the information that they need? We always are happy to consult with them when they have questions about travel. And so it's one of those, they're one of the challenging groups to reach out to. As summer gets closer, more mission trips happen, so we'll have to think more about that. And I know we came up with a solution with Zika, and I don't remember what it was, to be honest.
One more question, guys.
Wash your hands. That's the bottom line.
That's the bottom line.
Speaking of Zika
Yeah.
and doing that in the past, do you want to speak a little bit to what we do in response to the thousands of reportable infectious diseases that come into us every year?
Sure. So,
More of that ongoing system.
right. So I think another really important thing for people to understand is that, honestly, what we're doing with coronavirus, even though the attention's really hyped up, is something we actually do every day. We get reportable diseases every day. We have to call people up, talk to them about how they might have gotten it, what their risk factors are, talk to their family, help protect their family, help protect the people around them. We have TB cases in Knox County every year, not many, but we have some. And we have to put those people in isolation or ask them to stay in quarantine while we run tests. So we have processes, we have staff who are familiar with doing this. With Corona, it's got a little more attention than it has. It's new, people are more nervous. But we're busier. We're having more phone calls than normal. But we feel comfortable with providing guidance. We feel comfortable with if we do have to isolate people, if we do have to put somebody in quarantine, that we're able to do that. And I think the other thing to remember is that good, basic infection control stuff works with coronavirus. Wash your hands, stay home if you're sick, cough or sneeze into your arm or a Kleenex, and get vaccinated for the flu, because flu is more of a risk, and try not to touch your eyes and nose and mouth.
Do you want to touch on how the vast majority of symptoms for people are
Sure.
mild to moderate?
Sure. Yeah, so another thing that we've learned from some of the reports coming out of China is that about 80% of the folks who have tested positive for coronavirus, it has been a mild to moderate illness. They have not had to be hospitalized. We see a change in that when people are older, but in the younger populations, we're seeing that the illness, and again, 80% of the people who are sick, it's a mild to moderate illness where people don't have to be hospitalized. So that's encouraging, and I think that's all, yeah.
Can you offer people some advice for how to assuage the concerns of their elderly or immunocompromised relatives? Like how best to deal with them if they are concerned that they might catch this thing?
So right now, in this current environment, what I would say is that for the elderly and people who have compromised immune systems, they need to follow the usual guidelines of what they do to keep themselves healthy. We don't have community-wide spread in Tennessee. So, washing your hands, the rules apply for them too. Washing your hands, staying home if you're sick, avoiding people who are sick, and avoiding touching your eyes and face. I would say this too, it has nothing to do with coronavirus. If you're sick, it's not the time to go visit grandma in the nursing home. Grandma's more vulnerable than you are, probably to whatever you have. So if you're sick, stay home, give her a call on the phone or send her a card, but don't go visit. You're putting her and the people that live there with her at risk by doing that.
Okay, great. Thank you, guys.
Thanks.
Thank you,
Yep.
Judy.
All right.
Appreciate it, as always.
I gotta.
So
wire now.
Yeah.
I'm going to have to take you out of the
You have to figure out which ones are yours.
Sure,
That's
we'll
mine.
just